We have more for your ears only. I'm Eddie Robinson.
I'm David Alpern with this quote from the news, conveniently timed after the holiday season. That was a person briefed by law enforcement on the Neiman Marcus delay in disclosing until after January 1, a computer network breach that began in late July, and the retailer continued withholding the number of people involved. Also last week, Target reported that personal information of 70 million customers had been stolen by hackers, overlapping 40 million whose debit card numbers and PIN numbers were hacked. And Citibank joined J.P. Morgan Chase in announcing it would reissue the debit cards of all Target customers involved. Now this.
I'd unravel every riddle for any individual in trouble or in pain.
With the thoughts you'd be thinking you could be another Lincoln if you only had a brain.
In The Wizard of Oz, Scarecrow Ray Bolger regales Judy Garland with the mental agility he'd display if his head was full of more than straw. New science suggests more strongly than ever that for seniors, challenging the brains they already have will keep them working better and longer, and perhaps even delay, though not ultimately prevent, the ravages of dementia.
A first-of-its-kind $34 million federally funded study, published last week in the Journal of the American Geriatric Society, showed that relatively limited periods of mental training for seniors could leave positive effects even 10 years later. To talk about the study, its findings, and their implications for independent living, for your ears only, we're joined by one of its several authors, Michael Marsiske, Ph.D., Associate Professor in the Department of Clinical and Health Psychology at the University of Florida's College of Public Health and Health Professions. Welcome to the program.
Thank you for having me.
How many seniors were involved in your study?
We had 2,832 participants aged 65 and older from 6 locations around the country. They were about three-quarter female, and about a quarter of them were African American.
3 different forms of mental training were tested. Describe each one for us.
We had 3 training arms, as you noted. Memory training was one of them. These were done in groups with workbooks. We trained strategies that have been shown to improve memory for word lists, stories, and other verbal materials. So we tried to emphasize meaningfulness of the words, help people organize them into meaningful grouping, associate them with strong memories they already had. The other intervention arm was reasoning, and in reasoning training, also done in small groups, we focused first on helping people identify series and very abstract stimuli. So they might see a letter series like A-M-B, A-N-B, A, and be asked to judge what might come next in the series. That trains a series identification skill that shows pretty sharp decline in the later decades of life and is associated with doing everyday problems and managing daily affairs. Over time, as we made people more and more adept at learning these series, then we turned our attention to the kinds of everyday series that people encounter all the time, transportation schedules, medication regimens, and so forth. And our third training arm, we called speed of processing. That was done in small groups on computers. And what that really speaks to is the amount of visual information people can take in a glance. And what we did here was we gradually expanded what we call the useful field of view, the amount of visual information that people can pay attention to. The kind of presentations we're talking about are really brief, 16 to 500 milliseconds, so less than half a second, and we were trying to maximize how much information people could take in.
So what were the results? Which of those forms of training seemed to have the greatest impact as time went by?
What we found out was that all 3 training interventions had lasting effects after 10 years. People who received our reasoning and speed of processing training would still be performing better on reasoning and speed of processing tasks a decade after training and better than people who didn't receive training. People who received our memory training were still outperforming people who didn't get memory training 5 years after training, but by 10 years we were no longer seeing those memory benefits.
But all of those with any form of training said they felt more competent. I wonder, is that good or potentially misleading and dangerous if mental function was not really bolstered?
That's a very good question. I think there are a couple of possibilities. On the one hand, people reported, especially 5 years after training, feeling more in control. They reported less depression. They reported other more positive health-related quality of life. And so I think there's a lot of evidence to suggest that those kinds of feelings can compel people to take more active participation in their everyday lives. So on that sense, it can be good. But you're right. It's a caveat that I think we have to be mindful of. There's no question that what we see here at 10 years is people perceiving less limitation in daily activities. But as you know well, maybe feeling more positive about your situation will encourage you to keep on trying.
You were surprised at how little actual training was required for lasting effects a decade later.
Yeah, I quoted actually someone in another interview, also an NIH program officer, who said that given that about half of our trained participants received only 10 sessions and then no more, and yet they were still showing discernible benefits a decade later, that would be kind of like in the physical domain, going to the gym 10 times, never again, and still showing muscle and aerobic benefits.
And what's the next phase of your studies?
So the active study is pretty much done. What the active investigators are now doing separately and collectively is looking at ways to increase dosages of training. Are there ways that we can get people to think about this as daily mental exercise? There's a big national call for proposals right now to do brain imaging, to do what someone once referred to as look under the hood.
I'm wondering, for those of us not in the study, what are the implications and the lessons? I mean, is it enough simply to do more crossword puzzles, play more Scrabble or Rummy Cube, or try to remember how to hit a tennis ball or a golf ball?
I think the growing feeling is that the trick is to challenge yourself with things that you're not already interested in and already good at. Take on new things that are difficult and demanding, and that opens up a whole other area of mental exercise for you.
Michael Marsiske, Ph.D., is an associate professor in the Department of Clinical and Health Psychology at the University of Florida's College of Public Health and Health Professions. He was a co-author of the federally funded study on senior brain training's beneficial effects even 10 years later.
Gosh, it would be awful pleasing to reason out the reason for things I can't explain. Then perhaps I'll deserve you and be even worthy of you if I only had a brain.
Quote from the news, "This is my midlife crisis. The bangs. I couldn't get a sports car. They won't let me bungee jump, so instead I cut my bangs." That was First Lady Michelle Obama on turning 50. Well known for her stress on fitness and good nutrition, she refused to rule out Botox or other cosmetic enhancements in the future.
Next, Don't Be Afraid of the Dark. Inspiration from a sightless singer. For your ears only.